This article was published in the New York Times today, and it's absolutely worth a read if you are on social media. So this article discussed the situation with Sid Toll, and she's a young woman in her mid-20s who is going through cancer treatment in New York. Sid has a rare cancer called cholangiocarcinoma. This is a cancer of the bile duct, and she has an intrahepatic tumor and unfortunately has progressed to stage 4. She posts videos not only about her cancer treatment, but also about her personal life. And as per usual, if you get a following on social media, she's developed a group of people who dislike her for seemingly no reason. I always find it shocking that a group of people dislike someone they don't know so intensely that they want to form a full community around disliking this person. And that's exactly what happened to Sid. These people, and there were several people who were frequent posters in her snark, said just despicable things about her. They believe that she was faking her cancer. They don't like how she behaves. They think she should be more sullen, I guess. All kinds of opinions, but these opinions started to spill over into her personal life. They called cancer centers warning them about a fake patient because they, again, didn't believe she actually had cancer. She had a nice gifting that she did to nurses with products that she obtained from being an influencer. And people called the hospital, and she was informed the next time she came in for chemo that she could no longer do nice things like that for the nursing staff. Now, the Times investigators were able to identify some of the more abhorrent commenters on this snark page. One of them worked at a tech company, one was at a daycare, one was a yogi, and a woman whose nephew even died of cancer. And then the worst person who was a frequent commenter on this sub was a woman named Connie Wright, who works as a privacy officer for a health system. And of course, these people are always silent when they're confronted, but this was my favorite. This one of these nasty ones said, "My cancer knowledge is extremely limited. Please respect my privacy." These are the people that were harassing a young cancer patient. They want their privacy respected. So the Times did their due diligence. They spoke to her doctor. She does, in fact, have cholangiocarcinoma. They spoke to her oncologist, who is actually famous and very well known for treating this type of cancer, and verified everything. She is indeed a real person dealing with a really scary disease, and it's crazy that people would behave this way. Now, I've taken care of cancer patients my entire career, and I will tell you there is no correct or right way to behave when you're facing a life-threatening, life-altering diagnosis. And the reality that there are people who have faked illness or misrepresented illness to grift off the public does not excuse abhorrent behavior. Those people should be disgusted with themselves. We all should be disgusted with them. And I think it's important to consider the power of social media and groups on social media and how they can negatively affect your behavior. I'm so sorry, Sid, for what you've gone through. I'm glad you have an amazing team of doctors. I saw in the article that you were initially treated at my home hospital, Cedars. I hope you're going to continue to get amazing care and that the internet treats you with more kindness.